Hi, I'm Garvin. This telecast is on Asacolon. So Asacolon contains the active substance Mesalazine. This is an anti-inflammatory medicine used to treat ulcerative colitis and to prevent further episodes of Crohn's disease. Ulcerative colitis is a disease in which the lining of the large bowel or colon or back passage becomes inflamed, red and swollen. Crohn's disease is a disease in which the lining of the small and large bowel is affected and becomes inflamed. The tablets are called gastro-resistant tablets because they are covered with a coating which allows the tablets to pass through the stomach without dissolving. The tablet coating will break down in the bowel where the active ingredient mesalazine is released. Asacolon suppositories act locally on the lining of the lower part of the colon and rectum to reduce this inflammation. Asacolon comes as a 400mg, 800mg tablet or 500mg suppositories. When taking the Asacolon tablets, they should be taken before meals. The tablets must be swallowed whole, preferably with some liquid. Do not chew, crush or break the tablets before swallowing them. For adults, including older people, to treat ulcerative colitis, take 2,400mg mesalazine per day in divided doses. If required, this can be increased to 4,800mg a day. To prevent ulcerative colitis, take 1,200mg to 2,400mg mesalazine a day, once daily or in divided doses. To prevent an episode of Crohn's disease, take 2,400mg per day, once daily or in divided doses. These can be taken at various combinations of tablets. For example, if taking 2,400mg, you can divide this dose into 6 400mg tablets or 3 800mg tablets. Asacolon is only recommended for use in children 6 years of age and older. The actual dose will vary as it is determined individually based on the disease phase and the child's weight in kilograms. For further information, please talk to your doctor. If you forget to take a dose at the right time, just take the next dose as normal. Do not take a double dose to make up for a forgotten missed dose earlier. Common side effects include a rash or indigestion. If you're using the Asacolon suppositories, the recommended dose for adults, including older people, is to use three suppositories a day in divided doses. The maximum daily dose is 3 suppositories in divided doses. Do not swallow your suppositories. They should be inserted into the back passage. Empty your bowels if necessary and wash your hands before inserting the suppository and afterwards. There is little experience and only limited documentation for an effect of Asacolon suppositories in children. So stop taking Asacolon immediately and seek urgent medical advice if you developed unexplained bruising that's without injury, bleeding under the skin, purple spots or patches under your skin, anemia, which is feeling tired, weak and looking pale, fever, sore throat or unusual bleeding, for example nosebleeds. Do not take Asacolon if you're allergic to mesalazine or any other ingredients of this medicine. If you are allergic to salicylates, which is aspirin, or if you have severe kidney or liver impairment. Talk to your doctor before taking Asacolon if you have any medical conditions or illnesses, particularly if you have any lung disease problems such as asthma, kidney or liver disease, or have an ulcer in the stomach or intestine. As a guideline, follow-up tests for your liver, kidney and blood are recommended 14 days after commencement of treatment and then every 4 weeks for the following 12 weeks. If the findings are normal, follow-up tests should be carried out every 3 months. If additional signs appear, these tests should be performed immediately. So tell your doctor or pharmacist if you are have recently taken or might take any other medicines such as those which reduce the activity of the immune system, for example azathioprine, or anticoagulants, for example warfarin. The consumption of food, drink and alcohol does not interfere with the use of Asacolon. Previous data indicates that there are no adverse effects of mesalazine on the pregnancy and therefore can be used during pregnancy. If the infant develops diarrhea, breastfeeding should be discontinued. Asacolon has no influence on the ability to drive and use machines. However, if you are affected in any way, do not drive or operate machinery. If you have any questions, you can contact me through the Life Pharmacist. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.